I've been doing this show now for 3 years and I never tire of it. I look so forward to my Wednesdays. It's been a beautiful day. I've had a lot to be grateful for, alhamdulillah, and most of all I am grateful that you can give me your company today on my show for the next hour, where we have guests that are experts in their field, and we're so fortunate to have such people who come on board, share their expertise in their own time to enlighten you in the world of health. So how have you all been, and how are you enjoying the end of term? And I'd just like to congratulate all the children who have received their SATs results. And you know what? Whatever the outcome of your results have been, well done to you all. I think you should celebrate the fact that you have your results. The period is over now in your life and a stage is over, and look forward to the days and the summer holidays that you have ahead. So on behalf of Salaam Radio and myself, I'd like to bid you all congratulations, well done, whatever your results are, and just look forward to the ahead and what life brings you, and focus on what's going to happen ahead, and enjoy the holidays with plenty of ice cream. Don't tell your mummy and daddies that I advise you to have ice cream, being a doctor, and plenty of ice cream, plenty of chill out time, and just relax for the rest of the holidays for those of you that are about to break up next week. So, wonderful show we have here on board. Before that, I am going to give a shout out to my very special brother Zaid Mahmood of Creations Desserts, who has helped me enjoy the most amazing milkshake. Honestly, it was amazing, and I can still, I probably after the show I'm going to go there again, but it was the most amazing. So thank you so much, Brother Zaid, and I'd like to give them a shout out, with their wonderful brothers who give a wonderful dessert. Now, I'd like you to join in my show, as you always do, from a very interactive perspective, by tuning into Facebook Live, or you can tune in via YouTube Live. We're also on Twitter Live, which is amazing, and Instagram as well, which is wonderful. All you've got to do is follow Salaam Radio 1062 on the which is the Twitter handle, and like the Salaam Radio page on Facebook as well. Or if you'd like to send us a WhatsApp message, you may do so on 07745 278 978, or you can ring us in the studio telephone number 01733 602 133. It would be a pleasure to have your company. And today I thought that we would talk a little bit about something a little bit different. So we tend to stress a little bit more on women's problems, taboo issues in the community. So I thought, let's talk a little bit about some male-oriented problems as well. And I'm going to introduce our wonderful guest, and I will introduce our wonderful guest on the basis of his credentials, and I'll tell you personally how I know this wonderful guest. So we have with us today Mr Shabi Ahmed. He's a consultant urological surgeon at the Sandwell and West Birmingham NHS Trust. He's MRCS and FRCS. He's also the president of the Dow Organisation of Graduates of Northern Europe from 2018 to 2020, and I had the privilege of being able to present to him this when he was made the president last year at the event there. And he is the previous General Secretary of the Patients Welfare Association, advisor to the Indus Hospitals Healthcare Network and SIUT, which is the Sindh Institute of Urology and Transplantation in Pakistan, and also an advisor to the Midlands Doctors Association. Now, Assalamu alaikum, Mr. Ahmed.
Walaikum assalam, Shabina. It's a pleasure to be with you and all the nice guests all around.
Yes, and it's a pleasure to have you as well, Shabi. And from a personal point of view, I just want to let you know that Shabi and I went to medical school together. So we go back a very, very long way. But Indeed. We meet each other and we speak to each other a lot more than what we did back then.
we are still in the mode of being in the medical school. We haven't passed much time. We still talking to each another as if we are in in the medical college, and life is still the same.
Life is absolutely still the same. And you know what? I think we would never want it to be any other way. So it's wonderful to have my
Indeed, indeed.
classmate. And actually, I'm so proud of you, Shabi, because of the fact that, mashallah, mashallah, to see your classmates grow and thrive and see your families grow as well, it's just a pleasure. It really is. So I'm really happy that.
Alhamdulillah, God has been very kind, and we try to give whatever we've learned from our experiences to back to our people and our communities, and
Absolutely.
continue with the sadka jariya, as I would call it.
Yes, absolutely. And I personally know of people that have gone to you in capacity of patients who have sang your praises. So you are doing an absolutely fabulous job, and it's wonderful. It really is to have you on here. So Shabi, tell us a little bit about yourself and the areas that you specialise in, and a typical day in the life of a urological surgeon, because you must be very busy.
Right. In terms of what I do, the term urology per se is defined as the urogenital system. So
Mm-hmm.
this is to do with your kidneys, your bladders, for the prostates in men, and all the problems related to it. So it can most of the problems, it can be as trivial as a simple little infection in the bladder, a urinary tract infection, and going up to stone diseases, to all sorts of cancers, prostate problems, enlarged prostate, which is a very common entity in men, as well as various bladder problems, which is a stigma in its own way, because people don't like to tell their personal problems very publicly, be it men or women. And more so in our Asian communities, where there is a lot of issues with relation to the incontinence side of things. Now, being Muslims, we have to be clean, we have to offer our prayers regularly. And when the urinary system is not working properly, people tend to have difficult times in terms of maintaining their personal hygiene and be clean for their regular prayers. So, therefore, it's very important that these matters are looked up properly and in time, so things are not complicated, or things are not put offhand,
Sure.
and people can be helped much in time.
Yeah, absolutely. And I think that that's a really, from an Islamic community radio station perspective, where, people are listening to us. I think one of the main things that definitely comes across with a lot of our patients is the aspect of keeping themselves clean and away from impurities such as body fluids. And obviously, when you have urine issues, especially in men, especially those that are mosque goers, it does become an issue. And one of the things that obviously we'd like to discuss today, Shabi, is about lower urinary tract symptoms and what we call benign prostatic hyperplasia. But for the ease of patients and for our listeners, could you explain, please, a little bit about what the function of the prostate is, or however you'd like to go about it to explain the anatomy of the urinary system?
So, prostate is a small gland which sits at the entrance of the bladder. So, any urine that flows out of the bladder has to cross the prostate. In a normal individual, the prostate is not more than 15 to 20 grams in size. But as men age up, the prostate starts to enlarge. So the data suggests that about 50% of men above 60 years, and about 70 or 75% of men more than 70 years have got an enlarged prostate, which is double, if not more, than the usual size.
Oh,
Now, what it happens is that when the urine flows out of the bladder, if the prostate is enlarged, it occludes, or it stops the passage of urine smoothly, and therefore the symptoms that one feels is because of that obstruction.
sure.
Now, so this is the benign side of things. Having said that, the prostate cancer is the single most biggest killer in men in terms of mortality. Lung cancer is the most prevalent cancer in men. However, the most diseases, most deaths that can happen because of any cancer in men is due to prostate cancer. When you ask about the functions of the prostate, there are various functions to it. There are the prostate secretes is very important in terms of your sexual functions as well as your endocrine functions. Endocrine functions means uh, the hormone side of things, the creation of hormones, the stimulation of hormones. So for this functions that make a man, the the prostate is very important. Now, prostate disease per se is a disease of the more so of the middle ages as well as slightly elderly population, be it the benign side of things or the malignant side of things. However, despite being the most commonest disease in men, prostate disease has got by far the largest uh, proportion and the largest types of treatment available. And they would include uh, medical treatment in terms of tablets. There are minimally invasive treatments as well as various types of surgeries available in this day and age. So therefore, the stigma of having an enlarged prostate or the symptoms related to it should not be a problem in current times, and they should be properly investigated and managed effectively, and that will keep the patient happy, keep the symptoms to a minimum, keep them dry. And of course, there is always the patients that come to me, there is always the uh, apprehension that they might have got prostate cancer. Therefore, when they are seen in any urology clinic, they are investigated for that. They get their examinations done. They have their usual blood test or any other investigations that might be required. And therefore, we can reassure them from a urology perspective regarding cancer. Luckily, the incidence of prostate cancer in the Asian population is less compared to other ethnic origins. However, it is by far it's one should never take these things easy. There is the Asian population also do get prostate cancer. Therefore, if you have any apprehensions, please number one get yourself checked out in the primary care, and if there are any concerns, definitely get yourself referred over to the hospital for checkup.
Right, yes, and I think that that makes it quite clear. So we've spoken a bit about the function of the prostate and a little bit about the urinary tract system and how it all works together. And coming to the actual prostate itself, and you said that, you know, over different ages, how the prostate can grow, etc. So would you like to tell our listeners a little bit what signs and symptoms to look out for if we are thinking about any prostate problems, and when they would go and actually see a GP? So what's the normal function of urine passage? And obviously frequency of urine and passing urine more regularly can be associated with other medical problems, as we know, infections, etc. Diabetes is another one. When would an individual become worried about going to see their general practitioner for certain urine symptoms? And could you elicit and talk a little bit about those symptoms?
See, as you can imagine, the function of the bladder is to hold the urine. So, bladder is a bag, it's a hollow bag that stores the urine. Now, when the symptoms start to happen when the bladder is not effectively holding the urine, the things which come into fray is the increased frequency of micturition during the day, increased frequency of passing urine at night. Now, if any individual is passing urine more than once, then that is classified as unusual. Again, if anyone is passing urine more frequently than 3 hours during the day, then that is considered as unusual.
Right.
And then there are other symptoms of urgency. Urgency means that sudden compelling desire to pass urine, which cannot be stopped. And then there are symptoms of hesitancy, that somebody would like to pass water, but they are struggling. They are They have the signals coming that they want to go, but they can't pass urine.
Hmm.
The flow of the urine has progressively become slow over a few years, and people are feeling that they are not able to empty their bladder completely. And that is again one of the telltale signs that there is something not right and that needs to be looked into.
Sure. Sure. Um, I've got a question from an anonymous listener, and I'm going to read out the question. I'm hoping that you can probably shed some light or put this the questioner to some direction. So the
Sure.
questioner has said that they have had a procedure to loosen up the bladder, which was successful.
Hmm.
A few years later, they had noticed small drops in their urine, but not regular, but occasionally, and they had a urological procedure, but it says nothing seemed to have shown on the test, and he is still worried. What could be done after this? Would you be able to give any advice as to how to signpost this individual?
I think it's the information is a bit sketchy.
Yeah,
Not really sure what sort of procedure the person has had previously,
yeah. I'd
and
want,
then, and
yeah.
if the whoever the caller or the person is, if they can tell me a bit more about their symptoms, I might be able to uh, explain a bit more to them.
Okay, so whoever has asked the question, it would be wonderful if you could, number one, so you had a procedure to loosen up the bladder, which was successful. And could you further just elicit what type of investigations or tests you went through under urology? Was it sort of flow studies? Is that what you had? And you had a urology procedure. So I'm assuming that procedure, because you then say that nothing showed up on the test. So I'm assuming that what you meant by procedure is actually you had some type of an investigation to see if there was anything wrong. So,
Most importantly, what are the current issues? What are the symptoms which the
yeah.
person is suffering from?
So they've said that small drops in the urine, but not regular. So when you say drops, is it something you actually see in your urine? Is it blood you see in your urine? Or are you losing drops of urine without being able to control it? It would be useful just to know that.
Yes, exactly.
So if you could give us a little bit more history, then we can answer the question for you. But thank you very much for posing that question. And hopefully we will come back to you, brother, whoever
Sure.
you are. So that you've given a good insight, Mr. Ahmed, on talking a little bit about what the symptoms are. So that this person then goes to their GP. What would you expect the GP, or what could a patient expect when visiting their GP as to what the GP should do?
See, at the level of the primary care, the most simple thing that can be done is a frequency volume chart. Now, that is a chart which has got 7 questions to it and one quality of life question associated with it. Now, according to the numbers that are plotted with after the patient has plotted that chart, the symptoms are divided into mild, moderate, and severe. Mild symptoms are generally managed conservatively by lifestyle moderation, changing your drinking habits, losing weight, cutting down on smoking, all those uh, basic primary things. Whereas if the symptoms are more than that, if they are falling into intermediate or high grade, then that is a sign. Then the patient would need some form of tertiary care review.
Right.
So, all my listeners, especially my primary care colleagues who are listening to me at the moment, my suggestion is to have a frequency volume chart available, which is easily available or downloadable on the internet or from the intranet, and or available on the British Urology Association website, which is freely available. And any patient, any male or female patient that comes to you, ask. It takes literally 2-3 minutes to plot that chart, and
Okay.
that gives us a very valuable information as to whether the patient has got voiding dysfunction or storage dysfunction or incontinence or whatever the type of incontinence that might be, or if they are associated with any infections. Now, one other thing I would like to mention is where I did mention incomplete bladder emptying, which is a sign of blockage or an obstruction. If a patient, especially a male patient, is having urinary tract infection, because of an enlarged prostate, then it is a clear indication for hospital review.
Mm.
And most of these people end up having surgeries done because of the risk of complications related to infection, which could even be life threatening in certain occasions.
Right. Okay. Okay. That's very interesting. So, from a GP perspective, if an individual gets an infection and they have an enlarged prostate, what would the surgical procedure entail? Removal of the prostate, or?
As I said, in this day and age, we've got various modalities available. That is, it starts from medical management, that is tablet management. There are tablets available which can either relax the prostate or even shrink the prostate, albeit in a very small proportion.
Wow.
But in certain individuals, that is very adequate, very helpful, and that avoids potential surgery. Now, in terms of surgical techniques, again, there are various modalities available. Previously, we used to resect the prostate, and that used to be the only modality. However, that is still an option available. But these days, we have procedures like uh, what we call it as the procedure. The system is called as Eurolift,
Mm-hmm.
in which we put bands across the prostate and retract it to improve the flow of urine. That is, again, this treatment is not for all sorts of prostates, or not for all types of patients. However, certain elderly patients who are not very fit for surgery, however, would not like to have a catheter put in, would benefit from the surgery. Similarly, younger men who would like to avoid any prostate surgery in order to protect their sexual functions, they will be helped with this sort of procedure. Then there are newer modalities coming in terms of laser ablation of the prostate,
Mm-hmm.
aqua ablation, that using high pressured water under high temperature, the prostatic tissue is vaporized.
Mm-hmm.
And then, of course, the resection technique, which is the old school technique, that is still available, that is still one of the gold standard techniques available. So, by far, there are various modalities available in terms of dealing with the prostate, and therefore one should not think that if they've got an enlarged prostate, the only option is surgery. Yes, they might need to have some form of intervention, but that could be a medical intervention, that could be a minimally invasive intervention, or might be other sorts of issues. Previously, prostate operations, people used to stay in the hospital for 5 nights. Now, with most of these modalities, prostate operation is becoming a day case procedure, if not what we call it in NHS as a 23-hour stay.
Mm-hmm.
So the technology has improved, and by improving the technology, we have improved patient care a lot in the
Yeah.
last 10 to 15 years.
Yeah. Well, I think that was really pretty much straightforward. And I have another question from a listener who has said that I've been given the option to have removal of my prostate. However, I am aware that you can gain some loss of urinary function. I'm worried about whether I would have any deterioration of other functions, such as with relations with my wife.
See, with prostate surgeries, yes, there is a risk involved in terms of sexual dysfunction or erectile dysfunction, as we call it.
Right.
Now, that is one reason why in younger men who are sexually active, uh, we tend to avoid doing surgeries, because one thing is very common after prostate surgery, and what we call it as retrograde ejaculation, in
Right.
which we ejaculate rather than coming out, is repulsed back into the bladder, and that pretty much happens in all sorts of prostate surgery, whatever we do. However, as I mentioned to you about the Eurolift technique, that preserves the prostate tissue, that is only retracting it. So that can be used in this particular gentleman's case. He would be able to preserve his sexual functions for a good another few years,
Mm-hmm.
and improve his symptoms. However, uh, again, as I said earlier, not all procedures are same, and not all procedures are for the same individual. So they have to be tailored according to the patient needs, according to the symptom needs, as well as the characteristics of the prostate.
Sure, sure. So that has been really quite straightforward. Now we've got 1 minute left to the break, and we've spoken quite a bit about benign prostatic hyperplasia. When we come back after the break, it would be good to talk a little bit about those people that don't have surgery, what medication point of view we could help them with. But until then, Mr. Ahmed, it's wonderful. I call you Shabi, but I'm not used to calling you Mr. Ahmed, but there you go. But we will be back after the break with Mr. Ahmed, the consultant urologist. And please stay tuned. Please join us. And yep, keep those questions coming in as we're having some filtering through. And it'd be wonderful to answer your questions. So hopefully, inshallah, we will see you after the break where we talk a little bit more about urological problems and also lower urinary tract infections. See you after the break.
Stay tuned to Salaam Radio after this short ad break.
It doesn't take much to bring some difference. You give some change, which makes a change. Because nothing gets mileage like a charity. Just a little change turns into a chain. And before we know it, the results are massive. So give a little to make a big difference. For donations, call now. UKIM 0207 387 2157.
दोस्ता कियां परेशान है
जरा कर है ना सारा सौदा मुक्या वा मुल्का विच पैसे भेजने
हूं नहीं मार फूड वाले की फोन खड़का ते फ्री लोकल डिलीवरी कार मंगवा
अला ता उथे कै स्पेशल आ
उना की लबाई हाइजीन विच ग्रेड 5 चीज़ां चंगियां मियारी ते सस्तियां ते नाले ऑफरां ही ऑफरां
और क्या
ताज़ा गोश्त ताज़ी सब्जियां ते फ्रूट आटा चावल दालां मसाले ते जूस सारे बिल जमा करने गैस ते इलेक्ट्रिक नो टॉप अप भी करने पाकिस्तान पैसे बिल्कुल फ्री भेजने मतलब के एक चिड़ी ने दूध छड़ी ते हर शै लबनी
और जने ने आप उतरा
Amar Food Store and Halal Meat 613B Lincoln Road Peterborough telephone 01733 687374.
My name is Khalid Siddiq.
I'm Saif Adam.
Salaam alaikum, this is Baraka Blue.
Yo, this is your boy Harris J, and make sure you guys stay tuned to Salaam Radio 106.2 FM.
Salaam Radio, in conjunction with the Council of British Hajis, presents a Hajj seminar Sunday the 21st of July from 1 p.m. at the Allama Iqbal Centre, 157 Cromwell Road, PE1 2EL. Multimedia guide presented in English by Sheikh Suleiman Ghani and Abdul Akbar. Learn how to perform Umrah and Hajj. Practical guide. Interactive Q&A. Health and safety advice. Hajj travel shop. To book your tickets, visit cbhuk.org/events or call 0845 833 4145. Hajj Seminar, Sunday the 21st of July from 1 p.m. at the Allama Iqbal Centre, 157 Cromwell Road, PE1 2EL.
Do you own a restaurant or takeaway? Cater Fair is an expert supplier of new and used commercial catering equipment. Visit caterfair.co.uk for quality equipment on sale at the lowest prices, or call us on 01733 310 115 or visit us at 11 Royce Road, Fengate, Peterborough.
Gems and jewels. Wise sayings, interesting events, and moral lessons from Islamic history. The Uthmani ruler and the old woman.
It has been related that an old woman entered the hall of the ruler Suleiman al-Qanuni, complaining to him about his army that stole her livestock while she was sleeping in her house. The ruler said to her reproachfully, "You should have stayed up and taken care of your livestock." She glared at him and quickly responded, "I thought that you were awake, watching over us, my leader, and so I slept with a peaceful mind." The ruler said, "The truth is with you."
Broadcasting 24 hours a day, 365 days a year. This is Salaam Radio.
Assalamu alaikum and welcome back to the Body Health and Mind Show on Salaam Radio 106.2 FM. So we are on Salaam Radio 106.2 FM. I've got the giggles because I was just enjoying a bit of a joke with our station manager, Brother Qasim, and I'm still laughing. But that's it. That's the cheerful atmosphere we have here on Salaam Radio. It's wonderful to work here and to bring you the latest with news. But I won't dilly-dally because I could go on for ages if I just spoke about, you know, various things. But I have with me a wonderful colleague, a wonderful consultant urological surgeon, and my classmate, Mr Shabi Ahmad, here in the studio. And he's joining us to talk to us a little bit about lower urinary tract symptoms. So, Mr Ahmad, how are you finding the show?
Very good, thank you. It's been a pleasure to be here, and we are too much bound with our hospital practice.
Yeah.
And whenever I get an opportunity to speak to viewers like I'm doing now, or speak to colleagues in the primary care or in a community at large, it feels so good, and it makes you, energized. It gives you another perspective of how you carry on your daily professional matters.
Yes, it is. It's wonderful. In fact, it's very interesting you say that because I had a guest on quite a few months ago now, and they went back to Pakistan, and somebody there said to them that, oh, we saw you on Salaam Radio, which shows that there is so much. We've got an international listenership as well.
This
so
is amazing.
This show does make you famous too, which is wonderful to have.
Technology has improved our understanding of things quite a lot.
That's right. That's right. And before the break, we were talking obviously a little bit about benign prostatic hyperplasia, etc., and the procedures. Now, the brother who asked us the question initially, for which we asked a little bit more elaboration, he's come back to us. Now, this patient is a young patient, first of all, and he has stated that about 2 years ago he had a procedure to open up the bladder neck of his bladder, and it was successful. Everything was fine. And more recently, he has described a history of seeing small drops of blood within his bladder. So the procedure that he had was a camera procedure, so I'm assuming a cystoscopy, and nothing was seen on that cystoscopy. And they have suggested possibly going in a second time, but he is still having the problem and is asking as to what he could do. So I think that's a little bit more clear, isn't it?
It does, yes. It clarifies matter a bit. Now, it's very good that the gentleman has picked up the point of hematuria or blood in the urine.
Sure.
Now, by far, the most common cause of blood in the urine in any age is infection. Infection can be due to various reasons, whether there is a bug that has colonized in the bladder and has not been able to completely cleared off with antibiotics, whether the patient has got some form of outlet obstruction or is not able to completely empty the bladder for whatever reason, or the bladder has become, the muscles of the bladder have become weak and they do not have enough strength and squeeze to expel the urine out. And whenever there is stagnation of urine in the bladder, there is an extremely high risk of that urine getting infected. So therefore, that would be one of the issues. Now, with this gentleman having had a previous surgery, what seems to be a bladder neck incision, and current cystoscopy not showing anything, I just wonder whether there is an element of dysfunction of the bladder, which is not allowing the bladder to be completely emptied out, and hence getting an element of infection in it. So if the investigations are clear, like number one, he's had a cystoscopy. The other thing importantly is an imaging of the upper tracts, so checking the kidneys and the ureter with either a CT scan or an ultrasound scan. And if that is normal, then there are various medications that can be started on a long-term basis, be it low-dose antibiotics or various medications to help improve the functioning of the bladder, relaxing the prostate, to again helping in the emptying of bladder. So all these modalities can be used in this particular gentleman's case. Now it all depends on the severity of his symptoms, what is his age. Now, if he's in that age group in which initially he would have had a bladder neck incision, but now the prostate has increased in size, which might need a bit of resection or shaving off in layman terms, then that has to be looked into.
Absolutely. So I hope that that has conferred some clarity to you, brother. If there's anything further you wish to ask, please don't hesitate to ask us, and we will gladly put the question forward to Mr. Ahmed. Now, let's talk a little bit about medication for frequency of urine for those people who have benign prostatic hyperplasia or an enlarged prostate and don't undergo surgery but need help with their symptoms, which is namely frequency of urine and getting up in the middle of the night. So what would you give to patients then, and what options are there available?
See, as I mentioned about the frequency volume chart, in terms of patients having mild to moderate symptoms, the initial management is with medication. Now, for prostatic disease, there are two types of medication that are licensed. The most commonly being what we call it as alpha blockers. Alpha blockers, because prostate has got alpha adrenergic receptors, which are receptors which increase the tone of the prostate and keep it constricted and closed. Now, these medications, which are the blockers of these alpha receptors, it relax the prostate and help in the flow of urine out of the bladder. And again, they help in the improving the flow of the urine and emptying of the bladder. So for smaller prostates, for people who have started to develop symptoms but are not acutely unwell or acutely troubled with their symptoms, alpha blocker per se is very effective in the treatment of prostatic symptoms or lower urinary tract symptoms. Now, the second medication, which is for slightly more enlarged prostates, is a medication that is used to shrink the prostate down. Now, it is debatable how much actual volume of shrinkage is achieved with those medications. However, it is a very subjective assessment rather than an objective assessment in terms of checking the size of the prostate. It is more so in the improvement of symptoms that one would say that the medical management is being effective or otherwise. Now, besides these two basic medications, there are other things which are very effectively used for low urinary tract symptoms. And one of those things is the medication which we use for overactive bladders. Now, I would like to very categorically tell everyone that all lower urinary tract symptoms are not due to prostate only. They can be due to the bladder problems as well. And most commonly, overactive bladder. Now, it is a myth that overactive bladder symptoms only happen in ladies. A significant population or proportion of men also have overactive bladder. And these individuals will be significantly helped with the use of the medication which we use for overactivity of the bladder, i.e. the anticholinergic medications, and more so recently with some another new form of medication which is called as the beta 3 agonist. And another there are some medications which were initially licensed for use of sexual dysfunction, erectile dysfunction. Now, the recent data has shown that if used in a smaller quantity, they would be extremely effective for enlarged prostate, benign enlarged prostate as well. So, again, that is used and that is licensed for the use in BPH as well. So, there are various modalities available.
Yeah, okay. So, could you talk a little bit? A lot of people worry about the side effects, and namely, there's dry mouth is associated with, is it oxybutynin?
And the anticholinergics have got the side effects of dry mouth, constipation, blurring of vision, and palpitations. Having said that, these side effects are more related with the older generation of the anticholinergics, i.e. the oxybutynins, the tolteridines. Now, in this day and age, we've got more third generation and even fourth generation anticholinergics available, which are much better in terms of the side effect profile and more effective in terms of their symptom efficacy. So therefore, yes, there is an element of side effects involved, but not as difficult as it used to be a few years back. Therefore, do not think that, or do not get too much overburdened with the fact that the medications will have side effects. They might have got a small element to it, but if they are improving your symptoms, there is a balance to it. And one would like, or one would argue that if somebody is significantly symptomatic but are helped with these medications, albeit with a bit of side effects, then I think it's worth a try.
Yeah, absolutely. Now, moving on, we can talk a little bit about lower urinary tract symptoms, especially in males and sort of infection-wise as well. Now, it's not usual for men to get urinary tract infections. Would you like to tell the listeners why that is as compared to females?
Yes. Again, in terms of the lower tract symptoms, we, as a urologist, and I'm sorry I'm using a bit of medical jargon here, we the lower tract infections, the UTIs, are classified as simple UTIs or complex UTIs. Now, by far, as because of the anatomy of a male individual, any infection in a man is considered as a complex UTI. And complex UTI is a clear indication, or by guidelines, for them to be investigated and to have some form of intervention and treatment.
Right, okay. So every male that, say, walks into primary care that's diagnosed with a urinary tract infection by sending a urine sample to a laboratory that comes back with some type of bacterial growth, we would obviously treat them with antibiotic according to the sensitivity, but they do have to have a referral to urology as well.
That's correct, yes, because keeping in view, depending upon what the age of the patient and their presentation is, the reason why they are classified as complex UTI is that 80% of these individuals will have an underlying cause for the infection. Now, in the younger age group, the common problems would be a stricture in the urethra, a contracture in the bladder neck, or most commonly, stones in the kidneys.
Right, yes.
So these are the things which need to be investigated. Now, with a slightly more elderly population, there will be issues with enlarged prostate. There will be issues with dysfunction of the bladder. There will be issues with foreign bodies, i.e., a stone in the bladder sometimes. And again, sometimes it's about 2 to 5% of the patients with bladder cancers can present with infections or even hematuria for that matter.
That's right.
So that is the take-home message is: do not ignore hematuria, whatever age you are, a man or a woman. If you see any blood in the urine, you need to go straight to your own doctors, get yourself checked out, and your doctor would refer you if there are issues that seem not very simple to manage.
Okay. Now, it's really important that you have elicited this, because often what happens within primary care, which is the GP surgery, hematuria, just for simplicity of explanation, listeners, is blood in the urine, so any type of blood. And what we've often seen is that we will treat women for urinary tract infections, and yes, sometimes laboratory results do come back as showing some element of red blood cells, etc. But if we were to detect urine on a dipstick, as per NICE guidance, for females even, we still refer to urology?
The recommendation is that I mean, now I'm talking about ladies, that if any individual has had 2 infections in 6 months or 3 infections in a year, that is a clear indication for them to be referred for further investigations.
Right.
Likewise, as you mentioned yourself, any man with one proven bacterial infection is classified as a complex UTI and needs to be referred. Now, in terms of the non-visible hematuria, in there are laboratory investigations that will tell you the number of red blood cells in a specimen, and again, if the red cells are above a specific threshold on two, if not three occasions, then again they would need to be referred. Any male or female above the age of 50 with either visible or non-visible hematuria, especially if there is a previous history of smoking, needs to be referred to a urology unit under the 2 week rule for urgent investigations. So, because there is a 20% risk of bladder cancer in a visible hematuria and about 5% risk of bladder cancer in a non-visible hematuria in this age group and in this risk group with uh, with previous smoking, or somebody who has worked in the rubber industry in the past, or the cotton industry in the past, or mining or coal industry in the past. I'm sure many of our brothers and sisters who migrated to UK in the 50s and the 60s and the 70s and have worked in these sort of industries. And again, these unfortunately these are risk factors for future health concerns. Therefore, they need to be looked into.
Sure. Now, I've got a question here from a sister who says that I have currently been having, on average, a urinary tract infection every 2 months. Often there is growth for which I am given antibiotics by my GP, but this has been going on for a year or two now. Don't you think that I need to be referred to a specialist? I've suggested this to my GP, but they have said that I don't need to.
Well, as I mentioned, there are clear, nice guidelines. So anyone who's had 2 infections in 6 months or 3 infections in a year, it should be referred to a urology unit. So I would just re-emphasize the fact to this listener that they need to tell the primary care person, and I'm sure as a primary care physician yourself, you would agree that this is a clear indication for the patient to be referred.
Absolutely. I would definitely agree with Mr. Ahmed over here that if you've had the frequency of urinary tract infections that you describe, then most certainly I think it's time that you're seen by a specialist and proper investigation takes place as to what's causing this. Obviously, other factors, depending upon women who go through the menopause, etc., also get urinary tract infections too, are more prone to that. But if all underlying causes have been treated, then I think that it's important that you get the investigation that you should. The other thing that I think that I would like to ask as well, Shabi, is the fact that so many women tend to feel afraid of going for investigation, because I have a lot of patients who say to me that we've heard that the procedure, the cystoscopy, if one is done, is very uncomfortable. Would you like to describe the procedure of a cystoscopy to our patients, please?
Yes, I'm glad you asked this question. I think this is a very it's a myth, and people are really afraid of this. No, to put it simply, like the cystoscopy which we do in the outpatient setting is a small scope which is not more than the size of a 14 or a 16 French catheter, and it is a fibro optic scope which is a very soft scope and has got a light source attached to it, so there is no other complicating factor to it. We do this procedure under local anesthesia. We give you a 2% lignocaine gel in a volume which is adequate enough to moisten as well as anesthetize the urethra. And the procedure by far does not take more than 5 minutes to do. So, and it is a very straightforward procedure, and you can really see on the screen when we are doing the procedure and see the insides of your lower urinary tract, your bladder, the openings of the kidneys in the bladder, the movement in cases of females and youngish females. You can see the impression of the uterus coming onto the bladder, You can also sometimes see the impression of the bowels in the bladder. So it is an interesting exercise, but to allay the fears and the myths, it is not painful, it is not uncomfortable, and it is not traumatic. It is more of it is a simple endoscopy, and by far the simplest endoscopy compared to other sort of scopes that my other colorectal or the gastroenterology colleagues tend to do. So don't shy away from it. If there is any issues relating to hematuria, that is the blood in the urine, or if you've got UTIs happening again and again, if there are issues with your lower urinary tract symptoms which are not being helped with medication and they need for looking into, then please go ahead and have this procedure done. Rest assured, it is not painful, it is not troublesome. Most of the urology units, and again, I would not, don't hold me to it, but most of the urology units will have some form of lady operators available, be it a junior doctor, be it a specialist nurse, and lady consultants as well. So, if there is an issue with relation to that, most of our units across the country will be able to find somebody experienced enough to carry out these procedures in our sisters and in our mothers and other listeners.
Okay. Well, I think that was made that really quite clear. So thank you very much for that. Now we've got a few comments. We always like to read out the comments because it shows that we're being appreciated and our hard work hasn't gone to waste. So we've got Ahmad Food Store and Halal Meat, a very, very nice brother who owns this store. He's the one that has the unique advert on Salaam Radio. Nice show as always, very informative, which is great. Thank you. And then we have our very own Mr. Meb Mirza. Shabi and Shabina at their best. Well done, which is wonderful, isn't it? You only have to put another NA at the end of my name, otherwise we would have the same. And actually, my nickname is...
That would be a bit complicated.
Yes, that's right. My nickname is Shabi, actually. And also Mr. Imtiaz Khan saying very nice, thank you. And also Mr. Munir Ahmed, who's a good friend, who said, whatever the subject matter, your show is so informative. So this is wonderful that we have all of these wonderful listeners who are listening to our show. Now, in the last 2 minutes of the show, Shabi, before I announce some events, are there any take-home messages you would like to give to our listeners, please?
The most common or most simple important take-home messages would be: number one, do not ignore hematuria. It can be a manifestation of something sinister that needs to looked into. Number two, prostate cancer in men and especially in Asian communities is a real entity. Again, please do not ignore that. If you are having symptoms, get to your own GPs, get a PSA blood test done. If there are any concerns, get yourself referred. For my lady listeners, do not suffer alone at home with recurrent UTIs. Again, do not suffer with incontinence for the social stigma side of things, as well as men, of course, because I understand that it's a big issue for people to come out of their silos and come out and tell their intimate and tell their personal issues to a doctor. But rest assured, we can help you. We are here to sort out these problems for you. And with just very simple tests and just with very simple treatments, you will be significantly helped out. So do not suffer in isolation. Please come out, get seen by the primary care, get yourself referred, and get treated. We are here to help you, and we will be able to solve most of these issues, which in more than usual ways will be very simple manipulations. But please come forward and do not ignore issues which can be a threat to your life, i.e. in terms of the cancers and all.
Thank you very much. Now, Mr. Ahmed, Shabi, thank you so much for coming on the show again, and inshallah we will have you once again, and please continue the wonderful work that you're doing for all the community.
It's been an absolute pleasure, and it's been really good to talk to all the listeners around the world, wherever they are listening to Salaam Radio. And thank you to Salaam Radio again for having me and giving me the opportunity to speak to you, all the lovely people all around. Thank you very much.
No worries at all. Thank you very much, and Assalamu alaikum. So that was Mr. Shabi Ahmed, wonderful colleague of mine, an expert in what he does, and it was wonderful to have him on the show. Now, as always, we have some events that we have to share over here. One is, I'll do this very quickly. So the main is the Hajj seminar that's been sponsored by Salaam Radio. It's on Sunday, the 21st of July at the Allama Iqbal Centre from 1 to 5 p.m. And the venue and booking details, you've just got to call 08458 833 4145. Or alternatively, there is the event known as the Sultan and the State, but that's this Sunday on the 14th of July. Admission is free, available at the Visitor Info Centre on Bridge Street. And the quiz night, get your friends together and form a team at the Alzheimer's Society on Tuesday the 23rd of July at 7 p.m. at the Iqbal Centre on Cromwell Road. And hopefully, inshallah, I'll see you next week with another show, your very own Dr. Shabina Asad Qayyum on the Body, Health and Mind Show. Assalamu alaikum.